welcome in Congressman Pete Session, a Republican from the great state of Texas, serves on the Government Oversight and Financial Services Committee. Both of them. Welcome, Congressman. Good to have you on.
Good morning.
So we've been talking healthcare in this country for what, 35 years now, maybe longer, certainly a lot longer. Here it is once again, front and center, staring us in the face. Do either the Republican or the Democrat plan have any chance of passing today?
Well, probably not in the Senate, although I do believe that Senator Bill Cassidy's bill is not only the most honest attempt to make sure that people who are in the HCA, the Affordable Care Act, but that they have more flexibility. You see, I was on Obamacare, the ACA, for 7 years, and my insurance premiums went up and the cost of insurance went up dramatically. I never used my insurance. I simply used my $7,000 deductible. And this is our point to the American people and to our friends that are Democrats. They need to understand that the flexibility for people to be able to purchase their own health care, we don't mind helping subsidize it, but they need to be given options other than just us pay to help them out with this premium, and then the insurance companies take the rest of the money.
Yeah.
It needs to go to the benefit of the system and the person who's buying it.
Well, no Democrats plan to vote for the Republican plan today. That, of course, is your point, and Kilmeny's reporting it gives money to Americans, the individual, in a health savings account, and that they can manage it as they like. And then no Republicans are going to vote for this Democrat plan, extending the subsidies, and that money is paid, to your point, directly to insurance companies. Look at the numbers on your screen right here. Between 2010, you know it well, since you were in Congress at the time. Between 2010, when Obamacare started, through 2021, profits to insurance companies soared, going from $16 billion to more than $60 billion. And these numbers were just through 2021. Congressman, these are outrageous numbers. And then you hear the president on Air Force One saying this.
Well, I like the concept. I don't want to give the insurance companies any money. They've been ripping off the public for years. Obamacare is a scam to make the insurance company rich. Billions and billions of dollars is paid directly to insurance companies. We're not going to do that anymore.
The profits have jumped, Congressman, from 500 to 1,000% directly into the pockets of insurance companies. The numbers don't lie.
Well, sure, and you're correct. But you see, my Republicans also need to come up with a plan that instead of just focusing on the 13 to 20 million people that are on the Affordable Care Act, Obamacare, we need to move to the 120 million Americans, small business owners, people who are like real estate agents, people who are like small business owners, who need the opportunity to also get the same subsidy that members of Congress get, and that is to be able to buy their health care on a pre-tax basis. When this happens, it means it closes down the need to have what's called surprise billing, and people having outrageous bills that they cannot pay for.
Yep.
And then the insurance provider or the hospital, probably the hospital, writing off to Uncle Sam the uncollectible. And so we've got to be strong enough. Bill Cassidy and I teamed up 15 years ago when we offered the plan that competed against Obamacare. Now we're simply trying to say we need to give everybody freedom. And I think that parity issue is very important.
And putting the relationship between the physician and the patient back in the hands of those two individuals. I mean, we need a health care plan that will support that. And it sounds like the one you're backing and proposing does the best job at obtaining that goal. A lot of talk, Congressman, before I let you go here on Capitol Hill in the last day and a half, social media infiltrating. And I want to be clear, it's really hijacking the minds of our kids across the country, the future of our nation, literally being hijacked. That mom of that 17-year-old boy testified that her son was coached to commit suicide after getting wrapped up in these gaming platforms. And then yesterday we heard from Australia cracking down. Here's Julie Inman Grant, Australia's e-safety commissioner. I like the sound of it.
Well, this is Australia calling time on social media and the deceptive and harmful design features tethering our children to their platforms, gamifying it through endless scroll and snap streaks and autoplay, sending them down dangerous rabbit holes. You know, it's built into the system to keep stickiness through outragement.
I don't want Americans to miss this, Congressman. We heard Marsha Blackburn, Senator Marsha Blackburn, yesterday on Capitol Hill saying that Meta, the former owner, formerly known as Facebook, has hired, spent millions in lobby efforts to make sure that Congress does not pass Safety Act measures that would protect our children. Your take on this? What can we do? We have about 30 seconds left. I'm sorry for such a big topic, but I'm getting a hard wrap from the control room.
Well, my take is that my state of Texas has said that they will not allow cell phones to be in classrooms. We need to understand this as an addiction that our children have. It's even easy for someone who's older, an adult, to get addicted to the product. We need to understand this. This is harming America's competitiveness and causing our children to go down to a mental health problem, and we've got to do something. Senator Blackburn is right.
Kash Patel said they should be targeted as terrorist groups operating on the web. We'll see if this can get through Congress and we can stand up against a powerful lobby group on this one. We will be watching and covering it very closely. Congressman, thanks so much for spending time with us today.
You bet.